Good evening, everyone. My name is Gabrielle Davis, and welcome to the final presentation of Rowan University Planning Studio 2021. Thank you for taking the time to come to our class tonight. This presentation has been broken up into 6 different sections. First, the introduction, where I'll go over our team and purpose of this project, the process and methodology, followed by the concepts we focused on, which will lead us then to our context and data. Then we will get to the relaying some Glassboro community voices, which were integral to completing this project, transitioning us into the recommendations we've created to strengthen and establish food and health equity in the Glassboro community, which will bring us then to our concluding remarks. Then we will take questions and comments from the audience at the end. The planning studio consisted of 10 students, each contributing greatly to accomplish this project. Each individual brought their own talent, insight, skill set, and creativity to this project, which allowed us to finish in such a short amount of time. In addition to these 10 students, we were also advised by a professor and faculty advisor, Dr. Munar, who guided us and kept us on track through the entire process. Our studio partnered with the Rowan Community Planning and Visualization Lab, the Glassboro Health Equity Coalition, and the Bullock Garden Project. We will submit our final report to Glassboro Health Equity Coalition and Glassboro Board of Health. The purpose of this project was to create a vision plan to achieve food equity in Glassboro. We did this based on literature review, data analysis, and listening to community voices. This project is significant because of a number of reasons. According to the U.S. Census, about 22% of the nearly 20,000 residents live below the poverty level, compared with 7.6% of all Glassboro County residents. According to the City Health Dashboard data, about 70% of Glassboro residents have limited access to healthy and affordable food. According to published research, poor minority populations across the nation generally have limited access to healthy and affordable food. And finally, the issue of food inequity has become more crucial during the global pandemic. We as a class strongly believe that now is the time to talk about it and take action. We completed this project by following a 4-step methodology process. First, we had to understand the main concepts, which would build the foundation. These were food and health equity, local food systems, community food access, and more, which we'll break down shortly. Secondly, we began collecting and analyzing data. The studio had a data team this semester who worked hard in gathering socioeconomic data, data about the local food environment, food resources and projects, land use, and zoning. Next, we began to gather community voices. This is done through 3 main methods: online surveys, interviews of 21 local stakeholders, and 2 focus groups. Then, using all of this data information collected, we began drafting final recommendations for food-related projects, programs, and policy changes. Now I'll pass it off to Sam for the next section.
Thank you so much, Gabby. There are so many ways one can define food and health equity. Let me explain what, as a class, understood by reading literature. Food equity is a broad concept that all people have the geographic, economic, and informational access and opportunity to grow and consume healthy, affordable, and culturally appropriate food. If the world had complete food equity, such barriers such as food deserts, food swamps, and means to purchase food would not exist. Food equity can be tied to expansive concepts of health equity. Having complete health equity would mean that everyone has equitable access to physical and mental health services, medications, and healthy foods that do not lead to certain physical ailments. However, factors such as poverty, systemic racism, access to physical and mental health services do not allow for true health equity. We believe that addressing food and health equity is a racial justice issue because racial minorities generally may face more inequitable access to healthy food or health services. We needed to understand local and regional food systems. These systems refer to place-specific clusters or collaborative networks of agricultural producers, consumers, and institutions engaged in sustainable food production, processing, distribution, consumption, and waste management in order to enhance the environmental, economic, social health of a particular city, region, or watershed. In an equitable food system, all community members are able to grow, procure, barter, trade, sell, dispose, and understand the sources of food in a manner that prioritizes culture, equitable access to land, fair and equitable prices and wages, human health, and ecological sustainability. In order to achieve food equity in a community, The local or regional food system has to be democratically controlled so that community stakeholders can determine the policies that influence their food system. We study many types of projects that may be relevant to urban or suburban communities. The list is on the PowerPoint right here, but some examples are community gardens, urban farms, healthy corner stores, farm to table programs. The concepts and relevant case studies are presented in our final report. Now I'm going to present section 3 of the report, which is context. The southern region of New Jersey features many smaller to mid-sized farms that provide crops, fruit, and produce for a lot of people. Agriculture has always been a way of life for South Jersey for centuries. The first farmers were the Lenape, who cultivated several varieties of corns, beans, pumpkins, rice, and tree nuts. The natives that taught the first whites about many of today's popular commercial products such as corn, blueberries, strawberries, cranberries, and sugar maple. Glassboro was founded as a home to productive glass blowing businesses. Eventually, the industry died off. Farms and fruit orchards, especially peaches, became a major industry within this area and the region. Unfortunately, due to the rising cost of farming in the state, many mid sized farmers had to stop farming. Many farmlands were eventually sold to developers. One of our interviewees mentioned that there was a major racial divide within Glassboro throughout the 1940s to the late 60s. The interviewee said that when she was growing up, many of the main food sources, such as butcher shop, baker, large-scale grocery stores, were located in the white section of town. There was one major convenience store located in the black community at the time. Today, with Rowan University's expansion, Glassboro is known as a college town. In typical college town fashion, it has raised the price of living to some extent, but also has brought in food establishments which were not meant to be healthy but affordable, like McDonald's or Jimmy John's. Glassboro is a diverse town, and many of its citizens potentially disadvantaged. Out of its 20,000 plus population, 22% are under poverty, compared to only 7.6% of residents in Gloucester County as a whole. As seen in the map below, poverty is concentrated in census tracts 2, 4, and 6. The Delaware Valley Regional Planning Commission, or DVRPC as many know it, has created an indicator for potential disadvantaged census tracts in the 9-county metropolitan region. The indicators include 9 factors, including racial minorities, ethnic minorities, youth, older adults, disabled, and low-income residents. The maps on the right show a collage of all the 9 factors and a map showing a composite score. As we see on the map, Census Tract 6 ranked as above average disadvantaged on this regional scale. These maps gave us an understanding of the concentration of vulnerable populations who may face food insecurity or food inequity. To understand the built environment, we studied zoning, land use, and public transportation data in Glassboro. More than half of Glassboro lands are zoned as residential, more than a quarter zoned as public. In terms of land use, 44% of area is wooded. About 17 to 18% of land is used as residential or transportation. About 355-acre area is vacant. As the main mode of public transportation, Glassboro has a few bus routes, but they do not have full potential coverage in the potential disadvantaged areas. Many food resources are not connected to bus routes, including the 3 large grocery stores in town. The zoning ordinance in Glassboro restricts agricultural activities, including community gardens and greenhouses, and in certain areas, some zones have stricter restrictions than others in regards to the growing and sale of crops. There are restrictions in terms of housing animals and livestock in one's backyards. Certain farm animals are allowed on lots of at least 4 acres. Now about the food environment. According to the city health dashboard, 70% of residents in Glassboro have limited access to food, meaning they live more than half a mile from the nearest supermarket, supercenter, or large grocery store. According to the USDA data as shown on the right map. A significant portion of Glassboro has a co-presence of low income and low access of healthy food. The town has a high concentration of fast food restaurants. Full-scale grocery stores are not easily accessible from certain parts of the town without personal vehicles. On the positive side, though, Glassboro has several organizations such as Bullock Garden Project, Boys and Girls Club, Ascenda Mosaic Family Success Center, and institutions such as churches and schools that acknowledge food insecurity issues and offer food programs of various natures and scales. There are also food pantries fairly well spread out within Glassboro. There are two farms, both located more on the outskirts of Glassboro. The town has recently started its first community garden project on South High Street. Some lots are reserved for people with disabilities in this garden. The town will soon launch its first farmers market on New Street Park, which is located within the potentially disadvantaged tract. We have mapped existing food resources and showed them in relation to disadvantaged census tracts or affordable housing complexes. Now we'll pass it off to Kimani, who will present the community voices section of our report.
Thank you, Sam. After analyzing the available data on Glassboro's socioeconomic, built, and food environments, we wanted to learn about the community's perception on food equity and understand their vision for potential projects and programs. We captured community voices in 3 ways: through surveys, interviews, and focus groups, as listed here. By using different methods, we were able to reach out to diverse participants and capture diverse perspectives. We created and distributed the Glassboro Food Equity Survey in February and received 47 responses. I'm sharing a few items here, but the final report will have a thorough analysis of all the results. As seen in the chart to the left, while 68% of respondents felt they had easy access to healthy and fresh food, 26% indicated that they did not have such access. Those who had limited access to healthy and fresh food seemed to be most restricted by the high cost of healthy food, which they could not afford. Other factors mentioned were the lack of variety, the lack of knowledge about healthy food, and lack of transportation. We also asked about potential projects and programs that should be prioritized. The most common responses were community gardens, community fridges, nutritional education programs, food pantries with healthy food, food co-ops, farmers markets, and healthy mid-sized grocery stores. Some respondents asked for school-based programs such as healthier lunches and farm-to-table programs. Many respondents emphasized the importance of protecting the children of Glassboro from food insecurities. Two very powerful quotes we took note of were, first, people like me don't like to talk about it, but experience food insecurities all the time. I think food is a right, but many people don't have access to food, let alone healthy food. All the time, kids go hungry, and we need to do more collectively. And the second quote states, Glassboro is for rich people, where some kids go hungry. Though not everyone that responded to the survey faces food insecurities themselves, it seems like many people are willing to help. We partnered with the Glassboro Food and Health Equity Project to analyze an online survey that the project team conducted in February with participants of their Glassboro Grows program. We looked over the responses from 20 families who participated in that program. While all respondents go to local grocery stores, 39% of them also buy food from Wawa and other convenience stores. 6 respondents said that they do not purchase produce from farmers markets regularly. Additionally, 40% of respondents visit food pantries, such as the Samaritan Food Bank and the Pittman Pantry. More than 2/3 of the respondents have experience in growing vegetables, fruits, and herbs. The majority of participants grew food in their backyards or on their decks. 6 people mentioned that they are open to growing foods in their backyards. We also conducted a semi-structured interview with 21 people who are residents or stakeholders of Glassboro. We asked questions to gauge the interviewees' knowledge of the term food equity, as well as their ideas for future projects and partnerships within the borough, the university, and community organizations. Most interviewees offered their own definition of food equity, which were more or less similar to our own understandings. One interviewee stated that food equity is twofold, where an individual has both physical and financial access to healthy foods. All but one interviewee felt that food inequity exists in certain parts of Glassboro. Although they personally have not experienced it, They have seen it firsthand. One person who worked in the local school district for a long time described how many students were hungry most days and how the quality of school lunches were often bad. Someone else described how her neighbors, who are senior citizens with mobility issues, also face food insecurities. Two people agreed and added that while Glassboro does have food resources and assistance programs, transportation and mobility issues might be a barrier for some residents. A few people explained that grocery stores are often too far from low-income and minority neighborhoods, making it hard for these residents to stop there. Moreover, those who have physical access may not shop there due to high prices. Finally, one interviewee reflected on the food history of Glassboro, saying that once many residents used to grow food and keep small livestock on their properties. She described how Glassboro lost many of its local food businesses and specialty stores over the decades. All interviewees have suggested various types of projects, programs, and policy changes, most of which we have incorporated into our recommendations. The focus group was a student-led discussion on March 11th, organized and hosted by two members of this particular studio. 6 people participated in this discussion, which was more of an organic dialogue. When we first asked the participants to inform us on what the term food equity meant to them, there was a slight hesitation. This hesitation was great for our work because it allowed us to dig deeper into understanding people's lack of knowledge/clarity towards this topic. Our next theme was the overall accessibility to healthy food options in Glassboro, which included the impact of COVID on campus. Many students were left hungry due to COVID, which resulted in heroes, humanitarians, and genuine caring people going out of their way to provide for those in need of food. One really interesting idea that was brought up in the discussion was to place refrigerators full of food in every building on campus. This would allow students to grab a meal and go with no questions needed. We also had the opportunity to speak with a representative from the Wrong Road Initiative. This independent group is run by students who address food insecurities in Glassboro and partner with the Food Bank of South Jersey and Philabundance to serve food insecure students at Rome. We were also invited to attend an important meeting of the Glassboro Health Equity Coalition on March 26th. The meeting was run in a focus group fashion. 2 of our studio members attended this session and helped with facilitation and note-taking. The coalition includes Glassboro residents or representatives from various local organizations dedicated to food and health-related issues. The goal of this session was to brainstorm about potential future projects that may bring food equity into Glassboro. The meeting began with the coalition members talking about how racism can be involved in the topic of health equity. They explained that neighborhoods with the most minorities were also neighborhoods with the least access to fresh foods and overall betterment to their health. 17 participants were divided into 3 groups and had small group discussions. Once done, they came back to one main room to present their top ideas. Many of these top ideas overlap with our survey respondents and interviewees and are included in our recommendations. Now I'll pass it off back to Gabby to start our recommendation section.
Thank you, Kimani. Moving on, I'll be going over our project-oriented recommendations. To achieve our goal of establishing food equity through various projects, in order for residents to hold a variety of options to best suit their needs, affordability, and schedules, we kept in mind several project incentivized objectives. The first objective was to empower residents to begin cultivating their own food. These recommendations were proposed to increase ease of access, as well as to increase equitable access for people of all abilities and affordability. We recommend the implementation of additional community gardens, as well as home gardens for self-propagation. New gardens can be located inside affordable housing complexes and publicly owned vacant lots. Smaller gardens affiliated with religious institutions, schools, and nonprofit organizations should be provided with financial and other support for operation and management. Finally, nonprofits such as the Bullock Garden Project and Mosaic Family Success Center have programs to train residents on food production. These programs need to be retained and expanded with support such as grant funding. Our second objective was to increase healthy food supply through various initiatives such as healthy corner stores, a new seismic grocery store, or food cooperative or co-op, pop-up farmers markets, and community fridges. A healthy corner store program can be implemented by providing incentives for some store owners to carry fresh and affordable produce. This would be a way to enhance the local food system as well, since this produce could come from local farms, something South Jersey is plentiful in. A mid-sized grocery store or food cooperative can be another fantastic way to build a sense of community, not only between permanent residents of Glassboro and local farmers, but Rowan students as well. The downtown area may be a suitable location for a food co-op. In the figures below, we show an example of a co-op grocery at the intersection of High and Academy. Following many national and international examples, the store may have a rooftop farm with greenhouses to supply fresh produce. Pop-up farmers markets are a great way to build community morale, support your local food system, and provide access to affordable produce. They can be organized near affordable housing complexes and public spaces. A community fridge can cut food waste, build stronger bonds within the community, and provide people with nutritious, perishable food for free. Following Philadelphia's model, there can be a network of community fridges throughout the town. Our third and final project objective is to increase free access to healthy food by adding edible plants and fruit trees to Glassboro's existing landscapes and streetscapes. Here on the slide, you can see just 3 examples of where this idea could be applicable. The first is in Glassboro Town Center. We redesigned a small impervious space as an edible landscape. And in the other 2 simulations, you can see a row of apple trees placed on Route 322 by the library and rows of peach trees on College Avenue. The trees would provide shade to pedestrians and simultaneously create a barrier between cyclists and pedestrians, as the sidewalk is large enough to cater to both.
Thank you, Gabby, for talking about our recommendations in the project field. Now I'm going to talk about some program-oriented recommendations. The broad goal for these programs is to reinforce local food systems and community food security by engaging community institutions, increasing cross-sector collaborations, and empowering residents through various programs. The first objective is to serve food insecure residents by including healthy food options to existing charitable programs or creating and expanding such programs. This can be done through healthy food pantries, which is meant to provide these food pantries with access to fresh produce and fruits with a refrigerator to store dairy products, meat, and other perishable items. Gleaming and foraging programs should be developed in collaboration with local nonprofits, local farms, Glassboro Wildlife Management Area, and Tall Pines State Preserve. The programs can be connected to food pantries, group homes, schools, and Rowan University too. The second objective is to empower residents by increasing informational access and providing education and training programs on healthy food production, preparation, consumption, and business. These can be done through 2 types of programs. A communication hub would serve as a resource to share all food-related projects and programs in Glassboro. It can be used as an announcement center in Glassboro for residents in regards to food, such as letting residents know when a food drive is, or when a food pantry needs to close early or stays open late, and other food announcements. This can be done with the help of Rowan University and its students. As a part of a community education and training program, Rowan University and local nonprofits can collaboratively create virtual or in-person classes or training programs such as smart and healthy grocery shopping, cooking vegetables for children, and container gardening. The third objective is to create cross-sector collaborations between multiple entities to ensure equitable local or regional food systems. And this would be done through a farm-to-table program where local restaurants and schools would partner with the local farms to supply fresh produce, eggs, and other items that the farm would provide. Now Kimani will discuss some policy recommendations and conclude our presentation.
Thank you, Sam. In terms of policy changes, the goal is to provide financial and legislative support to establish healthy food programs and increase healthy and affordable food access. The borough should address the desires of the residents to grow food and keep poultry on their properties. These ordinances should be written to allow residents to produce food in their front and backyards. Also, a chicken and small livestock ordinance should be written to allow poultry production in the backyards of residential homes. In terms of financial incentives, there are a number of methods that the borough can apply. These include offering a tax break to multi-unit housing authorities that promote gardening within their complexes, offering incentives to corner stores to sell fresh and healthy foods, as well as converting some of the publicly owned vacant lots to community gardens. We believe we have accomplished a lot within these 4 months. Our final project report, or the vision plan, will include a thorough presentation of data analysis, community voices, and recommendations. We have also identified potential parties to lead or collaborate on various projects and programs. The document is currently being reviewed by our professor, who will share it publicly by the end of this month. The project website will also be updated. We face many limitations, but as a class, we have managed to navigate through a global pandemic where we relied solely on Zoom calls and working collaboratively. As a whole, this has made us a more resilient group of individuals who are capable of handling obstacles placed in our way. As the next step, we challenge the Glassboro entities and stakeholders to consider the recommendations included in this vision plan and try to implement as many of them as possible. After graduation, some of my peers may leave the town. However, you will still remain. We are confident that many of you will continue your great work to address food and health equity issues in Glassboro. We sincerely acknowledge all of our participants and partners. We could not have done this without their support. Thank you all for taking the time out of your day to listen to our presentation. I hope you all gained some insight about the overall food equity situation within Glassboro and the ways in which we can work together to change the problem at hand. We would now like to open up the Zoom to anyone who has any questions. In particular, please let us know if you or your organization would like to lead some of the projects that we discussed. I would now like to request Dr. Mino to facilitate the question and answering section. Thank you.